Welcome to our session on how to use healthcare coverage. My name is Aaliyah McKinley, and I'm the Director of Outreach and Education at the Asclepius Initiative. The name Asclepius is a bit of a tongue twister, but there were already so many wonderful organizations with the words Kentucky and health in their names. You may not be able to spell, pronounce, or remember it, but at least you'll recognize it if you see it again. Asclepius represents medicine and healing in Greek mythology. The mission at the Asclepius Initiative, or TAI for short, is to provide education and build support for the idea that everyone in the U.S. simply has continuous healthcare coverage from birth until death, so that you don't lose your insurance if you leave your job, get divorced from the policyholder, or move across state lines, events that can happen to any of us at one time or another. Medical care in the U.S. is expensive. A single ER visit or hospital stay can cost thousands or even hundreds of thousands of dollars. Healthcare coverage is a mechanism to help you manage these potentially devastating costs. The bottom line, coverage is not free. Someone always pays. Finally, a brief note on the consequences of having no insurance at all. People without insurance are less likely to receive preventive care, see a healthcare professional for a medical need, follow through with medical recommendations, or fill their prescriptions. They're more likely to be hospitalized for avoidable problems, and when they're hospitalized, they get fewer tests and are more likely to die than people who have healthcare coverage. These individuals are also more likely to have cancers diagnosed at later stages. And they're generally sicker and die earlier than those with coverage. There are also serious financial consequences associated with being uninsured. Not only are people more likely to forego care if they aren't insured, but when they do receive care, it can be at the cost of being unable to purchase food, clothing, or other necessities. It can also cause financial ruin. People who are uninsured often face unaffordable medical bills when they seek care. These bills can quickly translate into medical debt, since most people who are uninsured have low or moderate incomes and have little, if any, savings. Patients and their families are contacted by debt collectors about medical bills more than any other type of debt, and it commonly results in negative information appearing on credit reports. An important thing to be aware of, though, is that since April 11th, 2023, large credit reporting agencies no longer report medical collection debts below $500. However, it takes almost nothing to get to that amount: a couple of labs, an ultrasound, a colonoscopy. Bankruptcy is another all too common result of not having health insurance. Two-thirds of bankruptcies in the United States are estimated to be due to medical costs or time off work due to illness. There are multiple types of healthcare coverage in the US. Most people only qualify for one option at any given point in time, although there are individual circumstances where that may not be true. For example, if someone was over 65 and could sign up for Medicare, but they still have access to private coverage through their work. Each of these options you see here has a different path to signing up. A key point to note is that all coverage requires active enrollment. Coverage is not automatic. There are eligibility requirements, deadlines, and forms to fill out. Coverage can be lost due to failure to pay premiums or life changes, such as earning more than the Medicaid thresholds, switching jobs, getting divorced, the death of a spouse who is the policyholder, or moving across state lines. Most coverage programs require a monthly premium to keep coverage active. When a person receives medical services, such as visiting a doctor or having a medical test, they often have additional out-of-pocket costs, such as deductibles, copays, or coinsurance. These are known as cost-sharing expenses. The exact amount a person pays depends on the coverage program, the type of plan they have, the location of care, and how the plan is designed. There are a few key words that are relevant to almost every healthcare plan. Let's walk through what they mean. Household. The marketplace generally considers your household to be you, your spouse if you are married, and your tax dependents, such as children up to age 26. Premium, the monthly cost to keep your insurance coverage active. Key fact, for those whose insurance requires premiums, the premium costs must be paid whether any health services are used or not. Note, if you have a job-based plan, your employer usually pays the majority of this cost, although many employees are responsible for at least a portion of the premium. Most people who qualify for Medicare Part A do not pay a premium for that portion of coverage, but some do. Medicare Part B, Medicare Part D, and Medicare Advantage plans also have monthly premiums. People who buy coverage through the marketplace are responsible for the entire cost of their premiums, although some may receive income-based discounts. Deductible, the amount you pay out of pocket before your insurance starts sharing the costs. Note that preventive care services are typically covered 100% by commercial carriers without associated out-of-pocket costs. Example, if your deductible is $1,500, you pay the first $1,500 of covered allowable medical expenses yourself. Copay, a set dollar amount you pay for a specific service. Example, $25 for a doctor visit or $10 for a lab test. These costs are normally collected at the time of the visit. Coinsurance, your share of the allowable cost of a healthcare service calculated as a percentage. The formula, it is based on the allowable amount, which is the discounted rate the provider agrees to accept from the insurance company or government, rather than the provider's original charges. Example, if the allowable amount is $1,000 and your coinsurance is 20%, you would pay $200. Let's take a quick preview of an explanation of benefits or EOB statement to see the allowable amount and coinsurance in action to help this make more sense. You can see the billed amount and then the allowable amount. The first service we see had a billed amount of $120 and an allowable amount of $89.39. To the right of the allowable amount, you can see that coinsurance is $17.88. This is 20% of $89.39, which implies that this person has an 80-20 plan. We'll look at a more complete example soon. Out-of-pocket maximum, the absolute limit on how much you are at risk to pay for covered services in one plan year, also called the MOOP, or max out of pocket. What counts? Deductibles, copays, and coinsurance all count towards this limit. What doesn't count? Your monthly premiums or anything you pay for non-covered services do not count towards this limit. The benefit. Once you hit this, your insurance must pay 100% of covered services for the rest of the plan year. Networks, a group of doctors, hospitals, and other providers who contract with your plan to provide services at an agreed upon rate. As a rule, you will pay significantly less to see in-network compared to out-of-network providers. Be aware that some coverage arrangements do not offer any out-of-network benefits beyond coverage for emergency care. Let's practice. Now that you are familiar with these important definitions, let's see them in action in a real-world scenario. This is our pretend patient, Kai Armstrong. Meet Kai and his health insurance plan. Kai has a monthly premium of $300. Remember, the monthly premium is the subscription fee to keep the insurance active. Kai's annual deductible is $1,500. The annual deductible is what Kai pays for covered services, excluding preventive care, before insurance kicks in. Kai's coinsurance is 20%. This is a common 80-20 plan, so Kai's share of cost will be 20% after the deductible is met. Kai's out of pocket maximum, or MOOP, is $7,500. This is the absolute limit Kai will pay for covered services in a planned year. Note, premiums do not count towards the deductible or the out of pocket maximum. As we all know, accidents happen. Kai was finally tackling the big chore he'd been putting off, cleaning out the gutters before an incoming rainstorm. Everything was going fine until the very last corner of the house. The ladder hit a patch of wet grass, and Kai lost his balance and ended up with a broken arm. One surgery later, Kai is on the couch with a $30,000 bill he never planned for. Now that Kai is recovering, let's look at how his accident will impact his finances. The hospital charges for Kai's surgery total $30,000. Kai's allowable, the most that the hospital can collect as an in-network provider for ER, surgery, and cast, is $10,000. Kai's deductible, or how much Kai must pay in a given plan year before insurance will pay for non-preventive care, is $1,500. Kai has already met $500 of the deductible before the gutter accident, secondary to a lawnmower mishap. So the deductible balance, or what Kai currently owes towards the deductible, is $1,500 minus the $500 he paid before, and that equals $1,000. To calculate the remaining balance owed, we take the $10,000 allowable minus the $1,000 towards the deductible, and that equals $9,000. Enter coinsurance. Now that Kai's deductible is met, the remaining $9,000 is shared. Remember that Kai's remaining balance is $9,000. That's the amount after the $1,000 owed toward the deductible. Coinsurance. Kai owes 20% of the remaining allowable amount after the deductible has been satisfied. $10,000 allowable minus $1,000 paid towards deductible equals $9,000. $9,000 times 20% equals $1,800. So the official total owed by Kai is $1,000 of the deductible plus $1,800 coinsurance. $1,000 plus $1,800 equals $2,800. Looking at what insurance pays to the hospital, the $10,000 allowable minus the $2,800 deductible and coinsurance paid by Kai equals $7,200 that will be paid by the insurance company. Note, even though the charges were $30,000, Kai is, quote, only responsible for $2,800. After this visit, Kai has paid $3,300 towards his $7,500 limit, or out-of-pocket maximum. Remember that $500 deductible paid previously plus $2,800 for the broken arm. That equals $3,300. Kai still has $4,200 left until the out-of-pocket maximum is met. If Kai develops a post-operative infection requiring hospitalization and IV antibiotics and incurs expenses beyond the $7,500 MOOP, the insurance company will pay 100% of all covered costs for the remainder of the plan year. As we saw through Kai's experience, the definitions we covered, like premiums, deductibles, and out-of-pocket maximums, aren't just industry jargon. They are the rules and policies that determine where you get care and what it will cost you. Kai's story shows how health insurance works as a financial safety net. Without coverage, the cost Kai faced could have led to a much greater financial burden or even bankruptcy. With coverage, Those costs were somewhat predictable and limited. Thank you for coming to our session, How to Use Healthcare Coverage. Last step, please take our survey. The QR code to the left helps show our funder that people are using this material and increases the chance that we will be able to continue to provide useful information on healthcare coverage in the future. The middle QR code will take you to our educational materials on the TAI website. We have a lot of amazing free resources on our website, and I encourage you to check that out. If you are interested in staying up to date with the Asclepius Initiative, there's a lot of great information that we share on our monthly newsletter. Feel free to scan this QR code to sign up for that. We don't do anything with your information other than send you a great newsletter every month. You can follow us on the following social media sites. We're on LinkedIn, Facebook, Instagram, Blue Sky, and YouTube. I want to thank the Kentucky Department for Public Health and their grant that lets us bring this information to you at no charge so that people like you and me can get the resources we need to better understand our healthcare coverage.